Hi, this is Dr. Robert Brueck coming to you again with another segment of What's New in Cosmetic Surgery. I have to apologize, we've been off for a couple of weeks. My wife Linda and I were in Europe. Unfortunately, we were there when the terrorists struck Paris, and it was a very sombering moment. We were in Italy and Greece. And one of our last nights in Florence, we were sitting at a dinner table. It was actually Thanksgiving. And sitting across from us was an elderly French couple, and they heard us conversing in English, and so they reached over quietly and said, "Excuse me, are you Americans?" And Linda and I said, "Yes, we are." And we apologized for the tremendous carnage and the barbaric acts that were committed to not only individuals but to the country. And so they had left Paris to come to Florence to get away for a week, to get away from the terror, the bloodshed, the fear, and it's unfortunate that we live in a violent world. So what I'd like to do is take this time to wish each and every one of you a blessed Christmas and a happy holiday season and the richest of God's blessings in the new year. And I pray that we'll live in a new year of increased peace and comfort and safety and joy and cooperation among individuals and countries. It was very sobering what happened over there, and so our hearts go out to the French people, to the individuals, to the people in San Bernardino that were also victims of terrorism. We seem to be living in a more violent world each and every day, and I pray this new year will bring a greater level of peace and joy and happiness to our families and to our nation and to the world. So thank you again. Today I want to start off by talking about PRP. This past week I was doing some PRP on a couple of patients for facial rejuvenation. One was for severe sun damage and one was for severe acne. And PRP is a process, a procedure that I think is gaining in popularity. And what PRP is platelet-rich plasma. So the process takes about an hour, and what we do is patient comes in, we put a numbing cream on their face, we draw off their blood, and we get about 7 cc's out of 10 cc's of blood of PRP, platelet-rich plasma. Well, in the platelets are things called alpha granulocytes, and these have a lot of polypeptides and proteins that can be utilized to go ahead and restore a more youthful appearance to your skin. So if you have fine lines, if you have brown spots or melasma, sun damage, red spots, crusting, thinning of your skin, this is a nice technique that is probably a little more effective than just putting on a makeup. And I think doing something like microneedling with PRP and a good skincare program such as Rodan & Fields or Obagi, I think really is a wonderful technique. And again, it's outpatient. There's no cutting, no incisions or anything of that sort. And the microneedling is a handheld device that makes thousands of little needle pricks into the skin. And again, it's painless. And we call it collagen induction therapy. When you create a wound, like through microneedling or through a cut or a fall or anything, part of the normal healing process is new collagen. So we take the PRP and we go ahead and layer it on the skin, and then we do the microneedling. We do it vertically, transverse, diagonally, and it's a nice technique that we can utilize to improve someone's skin, especially if they don't want to go ahead and have anything in terms of surgical procedures. This can be followed up by skin peels, and skin peels are very, very effective in reversing the effects of sun damage. So it's something to think about, and if you want, you just can call my office at 239-244-2329. I'll be happy to send you some brochures or come in for a complimentary consultation. Second thing I want to talk about is PRP and hair loss. I can actually talk about it because I had it done. I only had one session. I think with any of these non-surgical procedures, I think it's important that you consider having more than one. In other words, if you had a microneedling with PRP, you're not going to all of a sudden magically look 18. Those years are gone. But what PRP can do is it can stimulate hair follicles that are quiescent and hence stimulate the hair growth. They did a study, and what they did was they took 20 subjects. They took their scalp and they divided it into 2 halves. One half received injections of placebo, which probably was saline. The other half received the PRP, Platelet-Rich Plasma. And they found that the platelet-rich plasma on average had almost 37 hairs extra per square centimeter. So there definitely was a positive effect on hair growth in people that suffered from male pattern baldness. Now the question remains, if I do one session, come back in 6-8 weeks, do a second session, is it cumulative? And the answer to that is not known. So more research needs to be done, but it's very promising, and I think microneedling is definitely here to stay, and it's a new tool in our little bag of tricks, if you will, to help rejuvenate our skin and make us look more youthful and better. The other thing I want to talk about a little bit today are the millennials, the younger generation. This was kind of surprising to me. I was reading an article. The millennials are people 13, 14, and 19, 20. And they make up about 1 to 2% overall of the plastic surgery population base. I would have to say in my practice, it's probably a little bit less than that. But more and more of these young people are coming in for cosmetic procedures. Just what is it that they're looking for? Well, the #1 procedure for millennials, believe it or not, was the old standby, the most popular procedure, Botox. Interestingly enough, I was talking to a lady this past week who had gone into her dentist, and he was examining her and said, oh, by the way, we also do Botox and fillers. So it's one of those things everybody is doing. Now you might ask yourself, why would a young person, 17, 16, 19, 20, want to get Botox? I think the advantage of a younger person getting it is that you prevent the development of deep furrows, lines, and creases, because the more you crease the paper, the more ingrained the wrinkles and lines become. So the adage you're thinking is, if I'm 18, 19, 20, 21, I get Botox now, I'll slow down and hopefully prevent the progression of development of deep furrows. And I think there's some truth to it. But then again, I think using a good sunblock, avoiding the sun, wearing a hat, might be a little more appropriate for younger people. The second thing that they wanted was peels. A lot of the younger people suffer from sun damage and acne, and so they wanted peels to improve their complexion. And I think peels are a great, effective tool in resurfacing and getting rid of brown spots and sun damage in our skin. The third thing was, of course, fillers. Some of these younger people wanted fillers to go ahead and fill in some of their acne scars and things of that sort. My personal feeling is I don't know if it's that effective, but it certainly is probably better than nothing. So millennials are getting on board. They're becoming part of the patient population in plastic surgery. So welcome, and we wish you well. The other thing I want to talk a little bit about, and I was reminded of it this week, medical tourism. A lady called my office, had some liposuction done in Colombia, and was now having some problems, and was wondering if I could see her. I think medical tourism is certainly here to stay. It's on the rise, and I think the main driving force behind medical tourism is nothing more than dollars and cents. I can go over here and get this, and done. Instead of $12,000, it's $5,000. That may be true. It certainly is cheaper, no question about it. But you got to ask yourself, why is it cheaper? I was reading some statistics on China. China is now the largest or second largest economy in the world next to ours. And it's a $62 billion market in China. As the Chinese become more affluent, they're more utilizing cosmetic procedures and cosmetic services. There are over 10,000 plastic surgery clinics in China. The number is growing by 30% a year. Think about that, 30%. So that's like 3,000 new clinics. It's mind-boggling. And a lot of the individuals that are in these clinics really are not board-certified plastic surgeons. It is not as regulated in China as it is here. a number of individuals from China will go to South Korea, which is right next door. Well, in South Korea, there are 10,000 practitioners, i.e. plastic surgeons. Of those, only 3,000 are licensed by the South Korean government to perform cosmetic procedures. So the vast majority of practitioners in South Korea really are not legally allowed to be doing this, but they do it anyway. So yes, we go there because it's cheaper. Maybe it's an ulterior motive to want to see China, South Korea, Singapore, Beijing, whatever the case may be. But I always tell people, you really have to be cautious. You really have to be cautious where you go. It's like this lady that had the liposuction was having some problems. How difficult would it be for her to go to Miami, get on a plane, and fly to Colombia? A little difficult. It's not like going to the corner store and getting a loaf of bread and a gallon of milk, so you got to be careful. Another interesting study that I read had to do with silicone implant, and it was in the International Environmental Journal. Some researchers at Oregon State University were studying implants that were removed. They were removed because women wanted them bigger, they had severe encapsulation, whatever the case may be. And what they found that there were carcinogens that were trapped in the shells of the implants. And one of them was a breakdown product of DDT. So in other words, the person was exposed to DDT, whether it was spraying in their neighborhood or exposure when they were younger, whatever the case may be. They subsequently get silicone implants put in, and the silicone absorbs some of these carcinogens. In 5 out of 8 implants removed, they found these carcinogens. And it's interesting to note that women with silicone implants have a lower incidence of breast cancer. So it begs the question, do the silicone gel implants absorb potential toxins in our body to prevent them from creating more injury to our body and damaging cells in our body overall? They did an experiment where they took silastic discs, silicone discs, and put them in mice and expose them to toxins. And again, the discs would absorb some of the toxins in the body. Now their recommendation was that maybe perhaps, I do a lot of implant exchanges, perhaps we should study the chemical makeup and products found in silicone implant. And it might be a pretty good study to perform, and we might be surprised at what we might find. The other thing I want to talk to you all about, I'm kind of excited about it. We're probably going to get it by the end of January. It is a brand new technology. It's called SculpSure. S-C-U-L-P, capital S-U-R-E. You can look it up, Google it. Brand new, just got FDA approval for non-invasive fat removal. Many patients come in and see me that have had CoolSculpting. Others call and say, do you do CoolSculpting? And we don't. I did a little research on CoolSculpting. It's effective in limited ways. I've had several patients who've had CoolSculpting, saw no effect. I had one lady that had a good result and she was satisfied. Basically what it is, you have a treatment head and you put it over the area of fat you want diminished, and it takes about an hour. Then you move it to the next area, another hour. So a treatment with CoolSculpt can be many, many, many hours in duration. Then if you want to come back and do the backside, it might be another 2, 3, 4, depending on how many times the treatment head is put in contact with the fatty layer you want to remove. And it's not necessarily the most comfortable procedure. A plastic surgery friend of mine says, you know, they tell you it's not uncomfortable. He said in many cases it is. Sort of like L-therapy. L-therapy can be very, very painful. Well, with SculpSure, what it is, it's a laser. It has a specific wavelength that targets only fat cells. There are 4 treatment heads, so you can treat a large area 23 minutes. 23 minutes is all. So theoretically, you can come in on your lunch hour, lift your blouse up, put the treatment heads on, 23 minutes later, walk back. It takes several weeks for the final result to come. The other nice thing about it is that you can go ahead and have more than one treatment. You can treat more than one part of the body. You might want to treat your stomach one day, another time treat your back and flanks and love handle areas. So it's a new technology that's pretty exciting. It's not painful. The representative that I'm working with had the treatment done, and he said it was sort of like vibration and tingling, but he said it wasn't uncomfortable. So you're going to be hearing more about this. I'm going to be putting it on the website. We'll be doing some blogs, and it's called Sculpture. So you may want to check it out, and certainly we'll do an announcement for all the people on our email list. We're sending out announcements. So we're pretty excited about it. So hopefully you might want to consider it, look into it. And again, I want to say thanks for viewing these short little videos on cosmetic surgery. And again, if you have a topic you want me to talk about, feel free to contact me. Email me at rjbrueck@abodyandface.com, or call me and leave me a message, 239-244-2329. And again, we have offices in Fort Myers, Cape Coral, and Punta Gorda. And again, a farewell, wishing you all a blessed Christmas, a wonderful, wonderful holiday season, and the richest of God's blessings in the new year. Thank you so much.